Welcome to the National Afro-Vegan Virtual Conference, Health Benefits of Plant-Based Eating panel. This conference features 24 presenters and 19 sessions that you can watch on demand for free. Thank you to our sponsors, Better Food Foundation, Veg Fund, and A Well-Fed World. Support Afro-Vegan Society's work by making a donation today.
This is a very, very exciting panel discussion. Today we are joined by three prestigious doctors who are going to talk about the medical benefits of plant-based foods. So I'm just going to go ahead and give the bios for each one of the physicians who are joining us today, and then we'll just go into discussing some of the questions that our followers have sent in to us, things that they would just like to ask of our three panelists. So I'm going to go ahead and get started with these bios. They are impressive. Dr. Milton Mills. Dr. Milton Mills is a graduate of Stanford University School of Medicine and a practicing critical care physician in the Washington, D.C. metro area. Dr. Mills's compassionate and encompassing worldview has led him to apply his knowledge about preventative health care towards the unique challenges of those who are underserved by the mainstream medical model, minority and less affluent populations. As Associate Director of Preventative Medicine for the Physicians Committee for Responsible Medicine, PCRM, he co-authored articles on the racial bias in federal nutrition policy, published in the Journal of National Medical Association, the Journal of the National Medical Association. A powerful public speaker, and most important, an empathetic healthcare ally, Dr. Mills is a foremost advocate for a whole foods, plant-based diet. Dr. Celeste Palmer. Dr. Palmer is a board-certified pediatrician who has taken a particular interest in nutrition as a means of healing and maintaining overall health. She welcomes the challenges of common recurrent childhood illnesses and is often approached to help families by conventional and unconventional treatment modalities. She offers a nutrition-based doctrine to her families and supports families in targeted lifestyle modifications. She has also been active in community outreach and teaching. The scope of Dr. Palmer's clinical practice has extended beyond the borders of her pediatric practice based on need, and she has had the opportunity to make contributions in healthcare by serving stateside and abroad. As her journey in plant-based medicine evolves, Dr. Palmer continues to cultivate and share the knowledge of reclaiming and maintaining wellness. Dr. Palmer is a graduate of Howard University and the George Washington University School of Medicine in Washington, D.C. She has also earned plant-based nutrition certification from the E. Cornell Center for Nutrition Studies. Dr. Baxter Montgomery. Dr. Baxter D. Montgomery is a board-certified cardiologist with years of experience in the latest medical practices and nutritional health. He is a clinical assistant professor of medicine in the Division of Cardiology at the University of Texas in Houston, a fellow of the American College of Cardiology, and the founder and president of the Houston Cardiac Association. Having seen many patients suffer the consequences of chronic heart disease, Dr. Montgomery founded the Montgomery Heart and Wellness Center in 2006 with the mission to reverse and prevent life-threatening illnesses. Located in Houston, Texas, the Montgomery Health and Wellness Center is a state-of-the-art wellness facility, complete with all the technology and resources to provide comprehensive medical and wellness care. Combining his medical practice with a food-driven lifestyle intervention, Dr. Montgomery introduces patients to a novel food classification system that helps reverse chronic conditions such as heart disease, hypertension, obesity, and diabetes without medications or surgeries. He has refined this process over the past 10 years with profound positive results in severely ill patients. In addition to running Montgomery Heart and Wellness, Dr. Montgomery manages arrhythmias and coronary disease, performs angiographies, I think I said that right, defibrillator implants, and other hospital procedures, and teaches young physicians. Dr. Montgomery earned his undergraduate degree from Rice University in Houston and his medical degree from the University of Texas Medical Branch in Galveston, Texas. He is also the author of The Food Prescription for Better Health, a comprehensive guide for reversing chronic illnesses. Wow, just wow. We are just so fortunate. I don't even know how we got so fortunate as to be able to have these 3 prestigious doctors, you know, Black doctors who are working in our communities to improve the health of our community. I mean, this is amazing. And so, and it's such an honor to be able to offer this life-saving information to the people who we've connected with and our followers, because again, it's life-saving. It is so important, especially during these times. So I'd like to thank all 3 of you and to welcome you to the National Afro-Vegan Virtual Conference.
Thank you very much, Brenda. Appreciate it.
Thank you, Brenda.
Thanks for having me. It's a pleasure being here.
Right. The pleasure is ours. So we have a bunch of questions that came in, and we want to kind of go through, cycle through them, and hopefully get some clarity for folks who have just had some questions that they have for, you know, a critical care physician, a pediatrician, and a heart surgeon. So we put it out there. What would you want to ask these doctors if you had a chance? And so these are the questions that came in. So for each one of you, I just wanted to ask, well, first of all, to say that more doctors are starting to recommend the plant-based diet for health. And then I'm curious to know, why do you think that all doctors aren't recommending the plant-based diet for optimal health? And, you know, we can go in whatever order. On my screen, I have Dr. Mills, and then Dr. Baxter, and then Dr. Palmer, Dr. Mills, Dr. Montgomery, and Dr. Palmer. So if you wanted to just answer in that order.
Sure. That's one of those questions that I don't know that we have a great answer to, because that's like asking, why is half the, 40% of the population still supporting Donald Trump after all that we've seen and been through? It's a big, but my take on it is as follows. I think most people know that nutrition and the relationship between chronic disease and nutrition is not a standard part of traditional medical education. And that is, and some people have thought that that might be for malevolent reasons, that, doctors intentionally want to keep people sick so they can make money off of them, but that's really not the case. The reason is that when you look at how Western medicine developed, it developed, really started to come into its own in the mid to late 19th century and on through the early part of the 20th century. And it developed around what were really severe, widespread, infectious type diseases that were prevalent back then and that were primarily responsible for killing people. And so Western medicine developed around this concept of the disease model, meaning that the doctors looked at a patient as having a disease, tried to understand what caused that disease, and then tried to develop therapies, be it medications or vaccinations or surgical interventions to try and redress that fundamental problem. So fundamentally, Western medicine approaches the idea of healthcare as we are in the business of treating sick people. And again, back as when Western medicine was in its infancy, the diseases that are prevalent now, which are directly related, or at least in Western countries, that are directly related to the ways we eat and live, those were rich people's diseases. Poor people at that time, poor and middle class people, were still largely plant-based out of necessity. They didn't have refrigerators. They didn't have a lot of money to spend on expensive animal foods. And as a result, they ate a primarily plant-based diet. Well, as we moved into the middle to late part of the 20th century, all of that flipped on its head. Suddenly, animal foods became very prevalent because of government cost subsidies and so forth. The price point came down. And then we dammed up all the rivers, electrified the nations, and suddenly everybody had a refrigerator and not an icebox. And what that meant was people could then buy dead animals and keep them from spoiling so that they could dine off them. And as a result, we've seen a major shift in what's killing people. What's killing people now are diseases that are directly related to eating animal foods. And so that's a long-winded way of saying that the vast majority of doctors aren't taught about nutrition, and therefore, unless they make it a point to educate themselves about it, they may not know about it. But beyond that, we have to understand that doctors are people too. And if they grew up in a society that taught them to be addicted to animal foods, they're as addicted as everybody else. And as we all know from dealing with friends, loved ones, significant others, denial ain't just a river in Egypt. People would rather deny that something is real rather than confront the realization that, hey, I need to change the way that I eat and live. And so a significant number of doctors would like to believe that it's still okay to eat animal foods because that's the way they were brought up. That's what they are used to doing. But fortunately, that tide is changing. And as you said, we see a larger and larger percentage of medical and health professionals starting to realize the importance of changing to a more plant-based way of eating and living to reduce our burden of chronic disease, reduce our individual disease risk, and hopefully live fuller, more productive lives.
Wow, thank you. I had actually never heard that explanation. That is very interesting. That little tidbit of history, that was a bonus to the folks who are currently listening to this, watching this panel discussion. Dr. Montgomery, did you have anything to add?
Yeah, that's. I think those are great comments. I think, and I agree with Milton by and large. I'll leave my political comments toward after the recording is done. What I will say is, what I will say there. I mean, I think the points he made are right on. That, you know, additionally, and I have before me here as an article in the Journal of American College of Cardiology. And the title is Saturated Fats and Health, a Reassessment and Proposal for Food-Based Recommendations. And the authors all go and talk about how we were probably remiss in not recommending saturated fats as part of the diet. And they were talking about meta-analysis and observation studies show how saturated fats can be beneficial.
Are you
serious? How they should be recommended. This is a recent journal, and actually I talked to Kim Williams about it recently. I'm trying to bring him on our show and discuss it. But the long and short is that if you look at the authors, and I haven't combed through the entire journal, I'm working through it, but you look at the authors of the article, and they're supported by the cattle industry, dairy industry, cattle, dairy, etc. So I raise that point just to raise the fact that there are other factors that are there. And so when we look at, or when you ask the question you ask, why, you know, do we promote, or why don't we promote a plant-based diet despite all the evidence? You can't just use the argument of logic to try to understand this. Because there are ulterior motives by people in other industries. Certainly the animal protein industry, the dairy industry has incentive for promoting those diets. And not only do they have incentive, they have lots of money. And then these individuals, they advertise in some of the medical journals. Then you have the pharmaceutical industry that benefit from it. So just think if you were to have a certain drug. Let's say I came up with a drug that prevented smokers from getting emphysema. Maybe it decreased the incidence of emphysema among smokers. And so let's say 90% of the population smoked, or maybe half the population smoked. So I had this drug that says, okay, this is a wonderful drug. I do a study and I give the drug to smokers in group A, and then group B smokers would then have a placebo. So drug A, group A would have the drug, group B, smokers would not. And so that would decrease emphysema among smokers. And say, see, this is a great drug. And then we go to the medical society and say, there's an indication that everybody needs to take this drug because this decreases emphysema among smokers. But I would never have a study that showed the benefits of this drug among non-smokers. So if I were to do the study and I say, I'll get another group A and another group B of non-smokers and have them take the drug and not take the drug, would it show a benefit? Well, the answer is likely not, because the drug's benefits in the setting of smokers. That's where we practice medicine. We say, okay, statin drugs or antihypertensive drugs in the setting of people that are on an animal protein diet is beneficial. But you don't have any studies looking at the benefits of these drugs on people on a natural, healthy, plant-based diet. What are the benefits of statin on the 100% plant-based diet food? We don't know the answer to that. So in the medical society, we say there's evidence-based medicine, but the evidence is incomplete. The evidence is in a setting where you're leaving a treacherous lifestyle and the drug is preventing a treacherous lifestyle. I mean, a bulletproof vest benefits you only if you're being shot at. And so the bottom line is that if you stay out of the line of fire, you can take the vest off. And so we constantly promote a lifestyle where we're in the line of fire of bad foods, the line of fire of, toxic foods. So therefore we have to take these drugs that show some margin of benefit, not necessarily a cure or reversal, but show some margin of benefit, reduction of symptoms perhaps, may make your numbers look better perhaps, et cetera. And then we say that's evidence-based medicine. And so there's an incentive for those who benefit from us requiring these drugs. There's an incentive for those who benefit from us living this lifestyle of an animal protein consumption lifestyle that's sort of a joint incentive to some extent. So if you force your animal protein lifestyle, that's going to give people disease, going to have to force them to take my drugs. So there are other factors. I mean, it's complex, and these are just some other factors I'm just throwing out there that contributes to this whole process, in addition to what Milton had to say.
Can I just say, Baxter, those were some brilliant points, and I'm stealing all of them.
I'm back at you.
Okay, Dr. Palmer, did you want to add anything?
I can add a little bit. I mean, a lot of it is definitely already covered. But I think that as a society, we have lost our holistic or our connection with nature. And I think it kind of reflects, our medical school education reflects our disconnection with nature that has happened over time. So as a child, we're encouraged to go outside and play. Well, I was when I was little. Nowadays, that has even changed. And so you understand nature a little bit more, and the more time that you spend in nature, the more that you understand the earth, the planet, your body, because you're watching the trees and you're watching the ants, and you there's something about that interaction with nature that helps you to understand science a little bit more. The more that you are sitting in the classroom, it removes the reality of that education from you. And so as we go through elementary school, middle school, high school to college, we are in the classroom more and outside of a natural environment. And so when you go to medical school, this is the epitome. This is the top of, we're sitting in the classroom, we're in the lab, we're listening to lectures all day. We do get into the hospital later on, but we don't have a lot of interaction with nature anymore. So now plants are just something that are pretty. They no longer work in our mind as something to heal us. So just the whole process and the whole system kind of pulls us away from the reality that plants, that these medicines that we're learning about are actually made from the plants. But that we know that in the back of our mind, but it's no longer at the front of our mind. And so that disconnection, and then in medicine, we have a tendency to compartmentalize a lot of things. So the compartmentalization also means that, the heart, the lungs, and all these systems are totally different. We're one body, but in medicine, we kind of learn these systems in different times, so we don't connect it all. And so I think the compartmentalization of our mind through education, through elementary school, middle school, high school, college, medical school contributes to us not reaching back and saying, where does all of this actually come from? How can we make this a holistic or one view where it all makes sense, where we're all connected to each other and we're all connected to nature? And so I think that contributes a lot. As my colleague said, there are a whole lot of factors, but I think we miss out on this factor a lot.
Wow.
Yeah, I'd like to comment on that.
Thank you.
I agree with Celeste, the comment on the fact that we're reductionists, everything's disconnected. I mean, the way we're trained in medicine, we got all these subspecialties, and this person does such and such. I mean, even within specialties, in my specialty, you got electrophysiology. That's my training, sub. And among electrophysiology, you got the ablationists and all that. And everybody's got these sub categories, and that whole concept of the separation of the human body, that reductionist, is really counter to reality and looking at the whole and understanding the whole. And we do that with supplements and medicines and all of it. These are, this chemical for this biochemical reaction, that, and there are trillions of biochemical reactions that are going on in foods that interact with them. And there's a dynamic process that we don't really understand. But if we, instead of trying to pick out little pieces and understand those little pieces, if we step back and as Dr. Palmer says, look at the whole of things, look at the whole things in nature. Because when we eat foods, we don't eat a carb or protein, we eat maybe broccoli or whatever the case is. And so it's really the whole of things that we need to kind of get a grasp of. But our teaching, and I don't even want to say education, because it's not an education. I mean, doctors are, in my opinion, are not educated. I don't even think we're trained anymore. I think we're more indoctrinated. It's an indoctrination of this is what you do because that's just what you do. And there's no understanding. And we do it to the point where, despite that patients fail, have side effects, we give them medications, and we don't step back and ask questions anymore. And so that's the problem. So that perhaps that separatism that Dr. Palmer talks about contributes to our mindset being, I think, disconnected.
Wow.
Yeah.
Wow. And that was just the first question. My goodness. Okay. I'm excited. So I am going to kind of jump around. I just want the doctors to know I'm going to be jumping around a bit. So I will start with a question for Dr. Mills. This question is about the kidneys. I think that this was someone who either they or someone who they know is having some renal failure. And so they were wondering, can kidney issues be addressed with a plant-based diet?
Okay, so I'm going to start off by saying yes, and I'm going to come back to, and discuss why. But I just want for the people listening and attending this webinar to understand that African-American people, Black people, have the highest rates of kidney insufficiency in the nation. We have more renal problems than any other ethnic group. And sadly, these dialysis centers that are proliferating around the country, you may not find a hospital or a medical clinic in a Black neighborhood, but you'll find a DaVita dialysis center. Yep. And so this is something really, really serious that we as people of color, particularly Black people, need to understand and take very seriously. The other thing that I want people to understand is that, dialysis is a life-saving procedure, okay? There's no question that that's true. Because years ago, if people went into renal failure, they just died. People may not know, the old movie star Jean Harlow, who died at the age of 27, died from renal failure because back then they did not have dialysis. So your kidney shut down, you passed away. I, in my own family, my youngest brother had kidney failure and was on dialysis for 6 years before he finally succumbed and passed away. So this is very real and it's very serious. And again, no knock on hemodialysis because it's life-saving. But number one, it does not do what your kidneys can do for you, because people who are on dialysis for a long period of time start to have all sorts of other health problems caused by the fact that our machines can't do what our kidneys do for us. Moreover, once your kidney fails, your life becomes completely contracted to that dialysis schedule, because you can't go anywhere. It's very difficult to travel because you got to get dialysis Monday, Wednesday, and Friday, or 3 times a week. A typical dialysis session lasts 4 to 6 hours. And in between those sessions, you can't eat everything that you might want to eat. You can't drink as much fluid as you want, because you can't get rid of that, those toxins in that fluid until your next dialysis session. So I'm saying this not to put a knock on dialysis, but to make people understand we have to do everything we can to preserve our kidney function, okay? And the good news is, and this is what's really wonderful, is that plant-based diets can arrest, that is, stop the progression of kidney disease. Not only can they stop it, but they can, in some cases, even reverse it. There have been individuals who were being prepared to start on dialysis who went plant-based and recovered enough function that they did not have to go forward to hemodialysis. So, and the reasons are the usual suspects. Animal protein is toxic to our kidneys. It causes what's called glomerular sclerosis. The glomeruli are the little filtering units in the kidneys. And when you eat a diet that is high in animal protein and animal fat, interestingly, it causes scarring in those filtering units so that they start to shut down and stop working. And it accelerates the rate of kidney failure, because essentially, as you lose filtering units, your kidneys lose their ability to do their job. And it's primarily the animal protein, the animal fat, but also the toxin loads that you get in eating various types of animal protein. That includes beef, pork, chicken, fish, and dairy. All of those are forms of animal protein loaded with toxins, loaded with these hormones that raise your blood pressure, cause increased stress on the kidneys, and will accelerate renal dysfunction. So if there's anybody listening who has renal insufficiency, you need to become plant-based today. You need to eliminate all of the animal protein, animal fat from your diet, switch to a plant-based diet, and I guarantee you, you will recover some function, and your progression towards dialysis will slow down and probably stop. So the answer is yes. Kidney issues are directly impacted by our diet. They are all improved by a plant-based diet, and well, everyone should be plant-based for a variety of reasons, but protecting our kidneys is a #1 reason.
May I interject? I'm sorry. I agree with all those comments. Those are excellent. And I like the fact that you emphasize beef, pork, and chicken, the things that destroy the kidney, because even after you're on dialysis, you should stay away from these foods. And the thing that angers me more is that patients on dialysis are told to eat lots of beef, chicken, and fish because they're supposed to get albumin up, which is wrong. It's wrong. And these patients die mostly from cardiovascular disease, not from renal failure. And the things that's promoting the cardiovascular disease is the recommendation. So for all of your listeners who may be on dialysis, or relatives on dialysis, if the dietitians are telling you beef, chicken, and pork, animal protein, get your albumin up, say no. And I don't care if they call my office, Google my name, call my office, and they ask me, I don't care. The point is that these things make the health worse. Let me share my screen with you. I'm sorry, feel free. Can I share a picture with you on it? Can you enable my screen sharing? I just want to show you a patient we had. I don't want to prolong this. Okay, real quick. So, is this sharing?
Yeah.
Yep, we see it.
Y'all see it? Okay, great. So this is a patient came in, he flew in from Connecticut, a gentleman with congestive heart failure. He came in and we drew his blood on this day, May 14th. And we didn't get the results back right away, but he was on high-dose diuretics, high-dose heart failure medicine, which includes the angiotensin receptor blocker, and the doctors in the room know that that affects the kidney, and so on. Of course, he was on the standard American diet, a little bit of vegetarian and all. So we put him on a detox. We saw him a week later. By the time we saw him a week later, we saw that this creatinine was 5.08. So we gave him a lot of IV fluids. We drew blood again on this day on the 21st. His creatinine was 12.8. GFR 7, as Dr. Milton Mills mentioned, glomerular filtration rate is how fast the kidney is filtering the blood. So if you blow this red line, which is 15, that means you need to be on dialysis. So he was cleared at dialysis rate. But my clinical assessment that this patient was volume depleted in addition to having perhaps some kidney failure as well. So we hydrated him aggressively despite the fact he had heart failure. So we stopped the diuretics, hydrated him. I ended up putting him in the hospital because this I hydrated him in the office. And again, another liter here. So 3 liters made a slight improvement, but not too much. So we put him in the hospital, hydrated him aggressively. He was on a raw plant-based diet here. So we stopped all animal protein, 100%. So over the course of time, his creatinine went down and the GFR went from dialysis level all the way up to 47. Now that's not normal, but it's a much greater functioning kidney. So even though he does have some kidney dysfunction, putting him on a raw plant-based diet made a difference in him. And that's what helped out tremendously from the standpoint of getting him turned around. I wanted to show that screen largely because it just shows how fast things can turn around if you do the right thing. Hydration plus a plant-based diet, you decrease inflammation, and kidneys is a vascular structure. So you may have spasm in the renal artery just like you have spasm in the coronary arteries. And that spasm may open up, inflammation may open up, so you may get better perfusion in a relatively short period of time. It's not a guarantee for everyone, but even if you have end-stage renal disease, these foods are harmful.
Let me jump in there and just say, Baxter, I love you, man, because I said something and you put up the slide to prove it. I want that slide. Okay. But you just proved the point that even as someone who's at the point of needing dialysis, that if they switch to an aggressive, exclusively plant-based diet, they can recover function. And as you said, a GFR of 47, while it's not normal, what's normal is considered 60 or above. It is close enough to normal that this person is no longer anywhere near the need for dialysis and will live a fully normal life, assuming they stay on the plant-based diet. So that's what's key here. And then I just want to interject, for those who already are on dialysis, obviously the goal is to get you a kidney transplant if we can. Again, this is why it's also important for you to be on a plant-based diet, because one, it will help you be healthier. It'll preserve your other vasculature, as Dr. Montgomery mentioned. And once you get that transplant, it'll help keep that transplant functioning healthfully for much longer than if you're on the standard American diet. And now, what's the knock about that? Well, people say, well, my doctor told me I can't eat a lot of plant foods because of the phosphate in it. Look, they put you on phosphate binders if you are a dialysis patient. So all they have to do is adjust the level of phosphate binders for the level of plant foods that you're eating. So the goal is not to stop eating plant foods. It's just to adjust the level of phosphate binders to compensate for the plant foods that you eat on a regular basis.
And I'll interject there too, because we were presenting a poster at American Heart Association, I think around 2017, et cetera. And next to our poster was actually a colleague of mine, Dr. Don Weston. I don't think you mind me mentioning his name. And he's a nephrologist, and they're at Baylor, Scott and White. And they did a study where they took patients who I think had chronic kidney disease stage 2 and 3, where it wasn't quite absolutely necessary to put them on bicarbs. They gave a group plant-based foods, a group bicarb, and a group usual therapy. And the group that gave plant-based foods, they didn't say you can only eat plant-based foods. They just gave them a lot of produce for free. They gave enough for the whole family. So what they found over the course of 5 years, these people just ate more plant-based foods, almost all plant-based foods. And what they saw is that they got better. The reason I'm raising an example is that when I talk to them about that, they raise the issue of phosphates and say the extraction of phosphates from plants is not as bad as from animal protein, especially beef. And so it's really, with plant foods, the body takes what it needs. And so they didn't have an issue with excess, phosphate consumption with plant foods as you would have with animal-based foods. And so, like as Milton says, you can always adjust the phosphate binding medications. But what they found in their study with now these weren't end-stage renal patients, but they were stage 2 and 3. There wasn't much an issue with phosphate binding. It was their opinion that it's not an issue in any patient with plant-based foods as much as it is with animal protein foods.
All right. Let me make one last comment before we let this horse run out to the pasture. And this is because I have seen in inner city hospitals and clinics, Black patients coming in who have renal insufficiency. So they're starting to tell them, okay, you got to get your shunt put in so we can let it mature. So that by the time your kidney shut down, you'll be ready to go on dialysis. And there is a little malevolence behind this. And let me give you some history so people will understand this. Everybody knows that it's very difficult to get health insurance if you're unemployed or underemployed in this country. The one thing that you can always get insurance for is for dialysis. And the reason is back in the 70s, a prominent, famous congressman died from kidney failure. And the congressional colleagues, out of, emotion and whatever, said, this will never happen to another American. So they passed a law that says any American citizen that goes into renal failure can automatically get hemodialysis. So you need to understand that dialysis is a money-making machine. And that is why, sadly, there are some physicians who don't try to get their patients to save their renal function, because they'll make much more money off of them once they actually go into renal failure and get on that dialysis bus. So please, if you have family members, if you yourself are suffering from renal insufficiency, if your doctor's not doing anything to try and help you learn how to preserve that kidney function, get a new doctor.
Wow.
Yeah, they get Medicare automatically. All the end-stage renal failure patients gets Medicare.
Automatically.
Wow. This is so illuminating. I'll just use that word.
I guess
okay.
If you have Medicare for all, you have dialysis for all. If we all got on dialysis, we can have Medicare for all. How about that?
Yeah. Wow. So I'm actually starting to think that each one of these topics could be like an entire, like panel discussion or presentation. Yeah. So this is just such a gift.
Especially if somebody's long-winded as Milton.
Well, it is much appreciated.
I'm gonna take that.
No, it's fine. So we're gonna move on to Dr. Palmer, and this is specifically about children and dairy. And the dairy question came up a lot, actually. And this first question is: can dairy products contribute to asthma in children?
Okay, so the quick answer that I would say is yes. And I'll talk about the history behind that later, but basically just in real life and in real practice, when patients come in with an asthma attack, eczema, allergies, a lot of times I'll say, let's do a milk restriction for 1 week for me, come back, and let's see how we're looking 1 week later. And in 1 week's time, I actually do see a major difference in the skin. I can see the skin. A lot of times we're able to decrease the use of albuterol and other medicines for asthma in those cases. And so we get less symptoms with the decrease of dairy. That includes cheese, yogurts, ice creams, all of the dairies. And I have to specify that with parents because a lot of times they're thinking only milk in a glass. But being very strict about reading labels during this week while we remove all of this dairy from the diet. Now, the literature, and that's where it gets a little bit confusing. The literature and research says that there is no connection between dairy and asthma. And that's where I understand parents and families will be confused, because if you're asking that question and one person is saying, yes, there is a connection, and then you read literature and it says, no, there is no connection, then you kind of, just like many things in the plant-based world, you're kind of like, well, what is real and what is not real? And so, but to explain that a little bit further, they're saying that dairy doesn't cause asthma, but it specifies that dairy, a milk allergy or milk intolerance, creates inflammation, and i.e. will cause asthma symptoms. So it's kind of, it feels like they're playing with words a little bit with people in this research, because at the end of the day, the question is, if I drink dairy, am I going to have symptoms of my illness, whether it be allergies, asthma, eczema, not whether this is the direct cause or if something else secondarily causes the problem. But so studies have shown that inflammation from the milk protein, because milk protein is created for baby cows, and they're large proteins. And so it causes inflammation in our gut. And what happens when we get that inflammation in our gut, the protein goes through the immune system, it goes into the circulatory system. The immune system sees that as a foreign body and a problem, and it starts to mount an inflammatory response to that. And then you get the wheezing, the runny nose, the congestion, and the symptoms that will lead to asthma if you have that chronic diagnosis as part of your history. So in a roundabout way, I'm saying yes, because at the end of the day, if you remove the dairy, the inflammation doesn't occur and you don't have the symptoms. Now, there are other things also, it's not just dairy, obviously. There are other things that contribute to asthma, but if you're asking specifically about dairy, I would say remove it, especially if you are prone to allergies, asthma, eczema.
Can I make a comment and then ask Dr. Palmer a question? I just want to co-sign what you said, Dr. Palmer, because the last in-person event that I did, this family came up and the kid came running up to me and he said, "Doctor, you're absolutely right, because when we stopped drinking, using dairy, my asthma went away." And the child's mother was standing there shaking her head like, that's absolutely the truth. So there's no question that there's connection. But one thing I did read was that children who are exposed to dairy fat and dairy protein as children can have a 3 times higher risk of developing heart disease and colon cancer as long as 50 to 60 years later. And I was just wondering if you could maybe just comment on that, because I think it's important for parents to know that, even if their kid doesn't have asthma, there are a number of reasons to avoid these dairy products.
Yes. So like I said, dairy creates inflammation in the body, and there are inflammatory factors. I think IL-7 is stated as one that can be tested and seen in the lab. And that's inflammation throughout the whole body. As I was saying before, we're one whole body. So one system inflammation equals another system inflammation. GI system inflamed allows factors to leak through and then create inflammation throughout the body. So in many instances, people don't make a relation between their dairy intake when they were 4 or 5 and their arthritis later on in life. But I'll try to explain to patients so that they remember when they first, a lot of times when children first start dairy at 1 year old, and that's when typically we're told to tell parents to start using cow's milk dairy. Usually a lot of children have difficulty with it, but parents will continue to push. And eventually the body says, forget it, go ahead and take it. And I tell them it's kind of like smoking a cigarette. When you first start smoking, you cough, hack and everything. Eventually the body says, forget it, go ahead and smoke the cigarette. But that does not mean the damage is not happening. So 10 years later, there's eczema, there's emphysema, there's cancers and things that come up with smoking cigarettes over years. So same thing with dairy. Eventually the body says, forget it, go ahead and drink it. But there's inflammation that's occurring over the years. And what that inflammation does is leads to heart disease, leads to arthritis, leads to other things, ulcerative colitis, maybe Crohn's disease, other things, inflammatory illnesses that we may have we don't even think about dairy as being the issue, but you've been inflaming your body low level throughout your whole life. In addition to many other things that are causing inflammation in our body nowadays in the current society. But if you can remove one thing that we know is a problem, then why not? Because technically we don't need, and that's what parents have a hard time understanding, or people have a hard time understanding, we don't need cow's milk at all. We don't need milk after the newborn period, because basically milk is the way babies eat, because they can't go out, they don't have the teeth and they can't go out and grab food from off the tree. And I'm talking about in the natural society where we're grabbing food from off the tree. So you're eating based on what your mother eats. Your mother's eating certain nutrients and vitamins. She passes it to you. Once you start getting teeth, you can now eat on your own, and you don't need to eat from mother anymore. And so that's why we're not supposed to really take any milk after that period. Now we have, as we know, made milk into something that is entertainment food. So it's sweet, it has a little bit of sweet to it. So we make it into butter. We make it into cheese, and people have a really bad cheese addiction, because now we're talking about concentrated milk, which even gives you more of like that high, because it hits those receptors nicely. So now we're talking about people being addicted to milk and milk products because of the sugar, salt, fat intake combination that it gives the body, and it gives us a rush. But all behind while we're kind of taking in this this product, it is creating inflammation, and inflammation is going to create a problem later on in life. And then sometimes too, I try to remind families, it could be things, it starts out simple. It may be, colds, recurrent colds when you're little. It may be acne when you're a teenager. Then it may start to become more chronic things as we get a little bit older. But a lot of the things that I see in medicine, if I get parents to remove dairy, a lot of it will clear up. And I think a lot of adults will see that, even, and the body is very forgiving. That's a good thing about the body. Even if you've been drinking dairy for 30 years, a lot of adults will say they took it out for 2 weeks and they could tell differences. They didn't wake up mucousy in the morning, because a lot of people wake up with, a lot of stuff going on up here in the morning. They felt when they went to the restroom, there wasn't a horrible odor coming out. So, people can tell the difference immediately. The body will respond immediately to our removal of a bad product that is creating inflammation in our body, which is a wonderful thing, because our body is very forgiving.
And again, I want to interject and agree with Dr. Palmer's comments 100%. Let me share my screen real quick. Inflammation is really important because it underscores pretty much all these illnesses we deal with. And in our study, in our population, I hope you can see the slides. Can y'all see this?
There it is.
We looked at patients in a defined plant-based diet in just a matter of 4 weeks, just 4 weeks. C-reactive protein is a measure of inflammation. We saw a 30% reduction in that inflammation. And this we've been seeing for over a decade and a half. This is just a study we did in the last few years. IL-6 is an inflammatory marker, a cytokine. Again, a significant 23% reduction, again, in just 4 weeks. Plaque-2, inflammatory cell inside the inflammatory process inside the vasculature, 16% reduction. We also saw reduction in white blood cells. Even though they were in the normal range, we saw a significant reduction of 20 to 30%, 15 to 30% across different cell lines. Very positive factor. So the point is, and we also saw a reduction in lipoprotein a, which blacks have a genetic predisposition to have a higher number. Lipoprotein a is a protein that has atherogenic potencies, which predispose to heart attacks, even though your LDL cholesterol may be normal. So I'm just showing you that in real life, and these are patients walking into the clinic that we did a study. We put them on plant-based food of our nutrition center, and they just follow that. And we also had a 40% reduction in their medication. So this is very powerful stuff that Dr. Mills and Dr. Palmer are talking about. And the reduction in inflammation, this happens very quickly if you do a very defined a plant-based regimen. So it's very helpful and very, very potent.
Baxter, that was a wonderful slide. I'm gonna need that one too, but I'm gonna give you full credit, man. I'm gonna put your picture on it.
Thank you very much. Good reminder.
All right, so we can just keep going with you, Dr. Montgomery. There was a question: how do eggs contribute to heart issues?
Dr. Neil Barnett used to say in his lectures, I guess he still uses this line, there's only two problems with the egg, the white and the yolk. But I guess I'll add a third part, it's the shell, in case somebody want to be desperate. But, eggs, consumption of eggs, even if you're doing the white egg, it's an animal protein. And we could talk about the cholesterol in the eggs, which is problematic. And so that's one obvious reason. If you're eating eggs, you're consuming cholesterol, and it can worsen that. Perhaps maybe more lethal than that could be just the fact that the eggs can trigger inflammatory reactions in the body, and protein from substance from animals. Animals are not foreign to us. So if you can, animals are foreign to us in the sense that, muscle from a cow or muscle from a chicken or a goat or whatever is not the same as muscle from the human. And same thing, the egg from the chicken or the cow or the goat is not the same as the egg from the human. And the way our immune system works is that it recognizes something that's foreign. And if something is foreign, it says, you don't belong here, and it triggers a reaction to it. Now, if you inject the egg into someone's bloodstream, you probably get a severe reaction. They probably have a severe local reaction, systemic reaction, they may get sick, may even die. Now, if you consume it in the GI system, it's a process that's a little more, less severe, less acute. But the bottom line, it still triggers an inflammatory reaction. And so the inflammatory reaction triggered by the eggs causes problems not only in the cardiovascular system, but other parts of the body as well. So the answer is simply yes, eggs are problematic for patients eating with heart disease or at risk for heart disease, or the consumption of the egg should be considered a risk factor for heart disease in and of itself. So so that's a pretty straightforward one, and egg consumption is abnormal and really shouldn't be something that that is part of the American diet.
So the next question for Dr. Mills: how does eating meat affect the colon?
Eating meat has a really very negative effect on our colon. And this actually occurs through a variety of different pathways. One of which Dr. Palmer talked about already, and that is the fact that animal proteins cause inflammation throughout the gastrointestinal tract. And that inflammation means that the small intestine and the colon are less able to perform their barrier function, meaning that part of what they are supposed to do is to prevent pathogens and allergy-causing proteins and substances in the things that we eat from getting into our bloodstream. But when it's just like if you've ever had a bad skin infection and your skin gets really inflamed, you notice that it starts weeping. Fluid starts leaking out of the skin because those cells are less able to perform their barrier function. Well, something similar happens in the gastrointestinal tract, that when it becomes inflamed, there's leaking that occurs, but it's, instead of stuff leaking out, stuff ends up leaking in that should not be in our system. And one of the really interesting things is that unlike the animals designed to eat meat, like say a lion or a wolf or a leopard, they have essentially an unlimited capacity to absorb animal protein. Why? Because that's what they're supposed to do. Humans, as plant eaters, do not have that unlimited ability to absorb animal protein. And so proteins should be absorbed in the small intestine. But unfortunately, what happens is when people eat a lot of animal protein, a lot of that animal protein gets delivered into our colon, where most people know we have a population of bacteria that act on substances that are delivered to them. Well, those bacteria are supposed to be breaking down plant fiber. And if you have a diet that's high in plant fiber, they break that protein down, that plant fiber down into these wonderful compounds called short chain fatty acids, one of which is a four carbon short chain fatty acid called butyrate. Why is butyrate important? Butyrate is important because colonic cells, the cells that make up our colon, prefer to get their energy from butyrate. Now, most of the cells in our body extract energy from the bloodstream, not the colon. The colon prefers to get its energy from the butyrate that is manufactured by the bacteria in the colon. So what happens if there's not enough butyrate? Well, or not enough fiber. If there's not enough fiber, you don't get enough butyrate. If you don't get enough butyrate, you essentially have a famine in your colon. The cells become weak. They lose their ability to maintain tight junctions, and you start to get what's called leaky gut. Literally, animal proteins and bacteria and other inflammatory compounds start to leak into your bloodstream, markedly ramp up the amount of inflammation in your body. But in addition, when I think Dr. Palmer had mentioned earlier, when your immune system sees these foreign animal proteins circulating in your system, it starts to make antibodies to attack what it recognizes is not you. No, that was actually Dr. Montgomery. And sometimes in susceptible individuals, those antibodies will also attack your own tissues. And this is why we see people get autoimmune diseases. And it's because the leakage of these foreign animal proteins that our immune system responds to, and those antibodies start to cross-react with our own tissues, and you can get rheumatoid arthritis, lupus, Sjogren's, a whole slew of autoimmune problems. But that's also why one of the most consistent stories that you will hear about a plant-based journey is someone with lupus or rheumatoid arthritis or some other autoimmune disease says, when I went plant-based, all of a sudden my disease activity started to plummet, eventually went down to zero, and now people can't tell I ever had this a disease. One of the other problems that happens is that plant fiber is made up of long chains of sugar molecules. And I know my explanations, as Baxter says, are very long-winded, but I'd like for people to understand what's going on. The difference between starch and, say, wood is simply how sugar molecules are joined to each other. And starch, they're joined by bonds that we have enzymes that can break apart. And plant fibers like wood, cellulose, etc., they're joined in such a way that our enzymes don't work on them. But bacteria enzymes do, and they can break apart this plant fiber, use that sugar for energy, and they create these wonderful compounds like short chain fatty acids. The problem with protein residues is that protein residues don't have any intrinsic energy. They can't be fermented. They can only be essentially rotted. They begin to putrefy. And studies have shown that people eating a Western-style diet create so much ammonia in their colon from the action of bacteria on these animal residues that over a 50 to 60-year lifetime, they can manufacture as much as 70 kilograms of ammonia over their lifetime. Again, ammonia is toxic. It destroys cells, it destroys DNA, it will cause cancer. That's just one of the ways that eating a high meat diet promotes cancer development. It also causes production of a bunch of compounds called cadaverine, putrescine. One of the reasons that when people eat a high animal food diet, you need a hazmat suit if you go into the bathroom after they've had a bowel movement is because they produce huge amounts of hydrogen sulfide. Hydrogen sulfide smells like rotten eggs. But that's what happens when you eat these high meat diets. So bottom line is meat is very toxic to our colon. It promotes inflammatory bowel diseases such as, and it can exacerbate or make worse things like Crohn's, ulcerative colitis, irritable bowel syndrome, and it will also promote the development of cancer over time. But beyond that, it will also cause inflammation that gives you leaky gut, which will predispose you to autoimmune diseases, heart disease, diabetes, and high blood pressure.
Wow. Okay. All right. So that question actually was able to expand.
Max, you got a slide for that one?
All right. So that question actually
I like that explanation. I like that explanation.
Yeah, it was great, and it covered a lot of other things. It actually might have answered a couple of other questions.
Well, I like the comment about the ammonia, because the thing is that
I got the study reference for that if you need it.
Yeah, no, I like that reference. No, please email that to me. But the ammonia, people have liver dysfunction for a lot of reasons: multiple drugs, over-the-counter prescription drugs, and animal protein consumption. And what happens is that the ammonia that's being produced has to be converted to urea. So if you look at the blood of somebody who's eating animal protein, and they go from, and I have slides showing the reduction of what's a measure in the blood called blood urea nitrogen. If you look at your blood, something called a BUN, capital BUN, that stands for blood urea nitrogen. And if you're eating animal protein, you have a lot of BUN because you're converting that ammonia to urea. And so if you stop eating animal protein, you have less ammonia, and therefore less ammonia to convert to urea. That BUN comes down. In fact, our studies show a very large drop in BUN, large because of the lack of converting that ammonia to urea. But now, guess what? If somebody has liver dysfunction, maybe you drink or whatever the case is, then you don't convert that that ammonia very well. And so what happens is that people start to get into early elevations of ammonia. And many of my patients are elderly with lots of medication of liver dysfunction. We have to take them off animal protein because their ammonia level goes up because the liver is no longer functioning adequately to convert that ammonia to urea. And so then you get high ammonia levels, which affects mental status. And oftentimes people have altered mental status, large because the liver is not functioning adequately, not because they have dementia. And so you clean up their diet, their liver, their brain function can improve to some extent, largely because the biochemistry of the blood improves. So ammonia being converted to urea is just one of probably many that we don't know of toxic substances that are not being adequately metabolized by the liver because you have liver dysfunction in the setting of animal protein consumption and the like.
Wow.
Oh my goodness.
Can I add into that? Just from the pediatric perspective, because a lot of times parents will come to me and they'll say their dad or somebody in the family has had colon cancer, and what are the chances of their children getting colon cancer now that they have this in their family. And I just want to emphasize to the audience that they understand a lot of times these diagnoses are not due to genetics as we are taught to think. It's more so due to the commonality of what we do as a family. We grow up eating bacon and eggs and pancakes in the morning when you were 5. So now when you are 25, you're doing the same thing. And now when you're 55, you're doing the same thing. So you have created, and I try to remind parents that what we do now is what we do in the future. Unless something happens and changes your view, a lot of times what you're taught and what happens around you as a child, you continue to do. So it does not mean that because granddad, dad, uncle had colon cancer that your children are going to automatically get colon cancer. You just have to change the habit, what we've been taught as normal. And we were talking about eating a lot of meats as being a problem, changing that rhythm in the family such that now you are actually filling the body with plant-based foods, because that's what we promote, to keep the colon clean, and that this meat is not sitting and rotting in the gut over time.
Yeah, families pass down disease more effectively through recipes than through genes.
Dr. Michael Greger says the reason diseases run in families is because eating habits run in families.
All right. So, Dr. Palmer, I don't know if this next question is related to the asthma question, but someone also asked, can dairy cause ear infections in children?
So that question is related to the inflammation. Okay, so the dairy creates inflammation in the upper airway, in the eustachian tubes. The eustachian tubes are what actually help the fluid naturally to drain in the posterior pharynx out of the middle ear. When you get inflammation in there, fluid backs up. Fluid sitting in the middle ear then becomes infected and you get recurrent ear infections. So it's just this inflammatory kind of response that sets up a great environment for bacteria to grow in the ear and for recurrent ear infections to keep happening. Because basically children who are baseline inflamed, i.e. my asthma, allergy, eczema children, they are going to continuously present with those symptoms in addition to recurrent ear infections because of the inflammation in the pharynx.
Okay, so definitely connected. I wanted to toss just since that question was sort of related to the other question, I wanted to toss another question in real quick, which is B12 deficiency common in vegan children, like children who eat a plant-based diet?
Is it common? So let's understand what B12 is. So B12 comes from bacteria. So we know that the issue with vegans not getting enough B12 is because it's stated that we're not eating meat, but the problem is we're not eating bacteria. So what I mean by that is we no longer go outside and pick apples from the tree and just eat it straight off the tree. We go inside and wash it off. So in that washing it off, we're washing off our B12. Now children actually in the toddler stages, they're mouthing a lot of things because they're teething. So they probably are picking up some. And so it's probably not as much of an issue in those toddler years because they're putting so many different things in their mouth. Parents kind of stop them from doing that because we see that in our current day society as horrible and nasty and gross. But we actually are supposed to do those things because it equilibrates our system to the environment that we're in. When I do go out to the garden myself, I try to pick some things up and eat it directly from the garden. I mean, I try to brush off some of the dirt, I try not to just directly eat dirt, but, but you can try to eat some things, brush it off and eat it from the environment. Again, getting back to nature and taking things directly from nature, because this is what the animals do. The cow doesn't go inside and wash off her grass before she eats it. So anyway, she's eating the grass. The grass has the bacteria on it, and these are what I guess we would consider good bacteria. It has the B12, she eats it, it gets into her muscle, and then when we eat animal products, we get the B12 through them secondarily because they have eaten B12 through the grass. And so like I said, in our current day society, we don't drink from streams anymore. And I probably wouldn't recommend that we do that. You would probably get some good B12 in that sense, but our water is chlorinated, which means it kills a lot of the natural bacteria in the water. And in current day society, I think that would be necessary because then we would have other issues like cholera being a problem. So since we don't have a consistent source where we know, well, since in nature, we can't really count how much B12 we're getting. And if we're worried about it, of course, there are B12 supplements available for us, for children. Also, their cereals I'm not a really big promoter of cereals, but cereals are usually fortified with B12. Nutritional yeast is fortified with B12, and there are vitamins that are children's vitamins for B12 in them. Okay. And also I wanted to add, typically B12 deficiency kind of presents, sometimes it's difficult to identify, and we need B12 for our nervous system. A lot of times it'll present as irritability, sometimes constipation, nausea. And so the symptoms are kind of soft symptoms, and you have to put a lot of things together to actually come up with, is this a B12 deficiency? A lot of times children can be falsely diagnosed with autism because some of the irritability, decreased memory, cognitive functioning is also related to B12 deficiency. So sometimes those children are diagnosed with autism when it may actually be a B12 deficiency in certain.
That was the truth bomb.
I tell you what. Woo! All right. I don't know if we're going to be able to get through all these questions, but I feel like folks have already kind of gotten an entire presentation and we're not even halfway through, right? So this is actually amazing. Dr. Montgomery, can arteries be unclogged with plant-based eating?
Sure. And what I'll do, I think you got a couple of questions that are similar. One is about stents as well, and I can kind of cover those in joint in the context of saving time. The answer to the, quick answer to the first question is yes, they can be. I've got a slide for that. And regarding stents, what I will say is that yes, stents are beneficial in the proper setting. And I'll address this first because it's a fairly straightforward answer. If somebody's having a heart attack, so somebody has, sudden onset of chest discomfort, they rush to the hospital, there's evidence of having a heart attack, that's when you do an emergent coronary angiogram or heart cath. And if you see a lesion that can be opened up and it's thought to be causing a heart attack, that's the lesion. So that's where stent is best. The other area where stent is best is where there's a threat of a heart attack. We call it acute coronary syndrome. Acute coronary syndrome is either a heart attack or a threat of a heart attack. Somebody's having chest pain, and maybe there's some abnormalities on the EKG. Maybe the enzyme's okay. If you do the heart cath, and there's a very tight narrowing in one of the arteries, then you would benefit from stenting there. So those are the settings where a stent is truly beneficial. Oftentimes individuals, and I'll go to the other spectrum, individuals who have no symptoms whatsoever, the heart is pumping normally, they get a stress test that's abnormal, get a nuclear stress test that's abnormal, then they get an elective coronary angiogram, and the cardiologist see a significant narrowing. And then the patient has no symptoms, but they have this narrowing. In that situation, the stent has not been shown to have any benefit over just medical therapy. It hadn't been shown, hadn't been studied head-to-head with plant-based diet. The in-between scenario, somebody has symptoms, but they're not acute symptoms. So maybe you're a little bit tired and you have a little bit of fatigue or chest pain with exertion, and then you get an abnormal coronary angiogram, and then a stent there has not been shown to be better than medications alone. So in that middle situation, someone can elect to have a stent because they say, well, I just want to get rid of the symptoms right away, and that would be reasonable. The scenario where there's no symptoms, I don't think that's reasonable. Now, in the in-between situation where you have symptoms but the heart is functioning normally, you can then opt to go for a plant-based diet or an aggressive lifestyle modification, I should say, with or without medications, and see if you can get rid of the symptoms. Because even when you do a stent outside the acute heart attack or acute coronary syndrome scenario that I gave you first, if you're doing a stent for symptoms, whether you're doing a stent or bypass surgery, if the heart's pumping normally, there's no scientific evidence that you're improving survival or decreasing the chance of another heart attack or treating symptoms in the long run. So a stent versus medication versus bypass surgery in somebody that has symptoms and coronary disease, but normally functioning heart is no difference in those three. So you may as well go the least invasive route first. And if that doesn't work, then you go with angioplasty and stent. So with my patients, I treat them, if they're not in the acute coronary syndrome setting, which, for years I'd have to cath these patients, we'd do emergency stents, emergency bypass. But if they're not in that situation, in the in-between situation, I sort of step back and talk to the patient. We think, so here's some options that we deal with. So there's situations where the stents can be beneficial, but a plant-based diet can be aggressive. Let me share a slide with you. And this is going to address some of the second question with the stents, but also the issue of whether or not arteries can be unclogged. So this is a patient we had that was in one of the studies we presented. a lady in her mid-40s who was initially trying to lose weight, went to a gastric bypass surgeon, but they saw some abnormalities on the EKG. She came to see us, and we did an EKG. Of course, it was abnormal. We did an echocardiogram, which measures the heart pumping function, and it showed that her heart was weak. It was pumping at about 24%, normal being 55% or 60%. So I told her I need to do a coronary angiogram because she was symptomatic. The chest pain was waking up at night. And when I did the coronary angiogram, you see the before here, and this is my catheter with the dark stuff with the contrast, and this is the artery. And you see the circle around this little area that's pinched in. That's a 90 to 95% narrowing of a major artery in the left anterior descending artery. And so we went, and so this artery would not, I talked to individual colleagues, and we couldn't put a stent here because if you put a stent here, you would put plaque in this left main area and you'd probably kill it. So we didn't want to do that. So after the procedure, I sat down with her and her family and said, look, we could do a single vessel bypass, open your chest up or do a thoracotomy or something, do a single vessel bypass and try to open it up. Now, of course, I had already talked about a plant-based diet and a detox before coming to the cath lab. And she said, no, I want to try that first. So it was her election to try that first. And so we put on the raw detox, we did adjust the medications, and after about 5.5 months, she went from this to here. And this lesion, of course, went away. And then, of course, the coronary, the main has got bigger here. This compared to the catheter is much bigger. So all these arteries opened up. This is all a natural plant-based diet. Now, we've had many other patients that have had this benefit. And of course, Dr. Dean Ornish showed a series of patients that had regression of coronary disease. Dr. Esselstyn have shown patients would have regression in coronary disease by 4 to 7% over the period of a year, respectively. So we know scientifically the evidence is there that you can improve coronary artery disease. In fact, the diet is going to be better than a stent to bypass. The reason is because when you do a stent to bypass, you only bypass a certain lesion. If you notice, and I'm going to show my slide again real quick to point this out. If you look at a coronary angiogram, there's an area that you see in the coronary angiogram that, that we can see this narrow. So for instance, if I look at this area here, I can say, okay, that's a blockage there. But what I don't see is that there's plaque all throughout here and there. But it all looks relatively normal, even though this looks abnormal, but there's plaque everywhere. So if we were able to stent this or bypass this, we would treat only this lesion. But how about all of this and all of that? Because atherosclerosis, when you get atherosclerosis, it's like carpet all over the vasculature. And so you get areas that are discrete, but you can treat these discrete areas with a stent or with bypass, but you don't treat the areas that are less well seen. And the area right here or an area right there could cause a heart attack as much as, or perhaps maybe more so than an area that's greater than 50% stenosis. We know that a large percentage of patients that get heart attacks from areas that are not seen on angiogram. In fact, I had a situation where I was treating a patient emergently, and I was called to the emergency room. The patient in the middle of a heart attack, having this very significant heart attack. EKG is positive. I rushed into the lab, did the coronary angiogram. By the time I got to the lab, the clot that was clogging the artery had dissolved, had burst. The body had lysed it. What was left was a very small plaque that was not able to be seen on angiogram. So when I shot his coronaries, he had what looked like clean coronary arteries, despite the fact he was having a heart attack that night. Now, what we know scientifically is not so much the amount of narrowing, but the friability of the plaque. Now, let me explain. If you have, and I used to have acne as a kid, so I understand this, and those of your audience who've had acne, you know, like you get those little juicy pimples that have a little thin piece of skin there that just, if you just sort of tap it, it'll burst, right? Well, that happens in the coronary arteries. You get the plaque that we see is like a pus, a amount of pus. Now, the pus, the acne that has thick skin around it, it doesn't burst. The acne that has thin skin around it is easy to burst. You can just sort of put a little
pressure that is bloop, and pops out. That's where coronary arteries are. So a friable lesion is like the acne pimple with a thin skin. So when it bursts, it triggers a biochemical reaction that causes a clot to form right there, and it clogs up the artery right there. And so you can have a very small or shallow plaque, but if it's friable, it's easy to pop. And when that underlying tissue gets exposed to the blood passing by, it triggers a coagulation pattern that causes a clot, and that causes the heart attack. So you can have heart attack with a 10% lesion, or 20% lesion, or 30% lesion, and these lesions are not well appreciated in the setting of a coronary angiogram. So that's why if you get a stent, I may look at the coronaries, I'll stent an 80% lesion, but there's a 20% lesion that I don't see. So if I put a stent in the 80% lesion, guess what happens? That increases inflammation in the cardiovascular tree. So that causes more inflammation, and that friable lesion is more prone to maybe becoming less stable and rupturing and causing a heart attack. So that's why you had a cancellation factor. And we've had patients have heart attacks while getting a stent placed, a heart attack while getting bypass surgery, because these are inflammatory inducing programs. So while I won't say a stent is never beneficial, it is beneficial in the most acute setting, but you have to use it selectively. And you have to realize that many of these stable plaques can be treated medically and, more importantly, nutritionally. And you can get regression, or at the very least stabilization, I should say more importantly, stabilization of the lesion. You decrease inflammation, you allow that core to form and stabilize, and you decrease the chance of a heart attack.
Wow. That was intense. Woo. All right. Okay, so Dr. Mills, it occurred to me that a couple of these questions were actually answered in another one of your talks that you did for us for our Dump Dairy event. Okay. So we're going to send folks over to that talk and encourage them to either watch it for the first time or rewatch it for sure. There was a question that came in. It was about type 1 diabetes. And they were wondering if type 1 diabetes can be influenced by healthy plant-based eating.
Sure. And that's an important question, because type 1 and type 2 diabetes are very different diseases. Type 1 diabetes, which used to be called juvenile onset diabetes, is actually an autoimmune phenomenon where the body's immune system attacks the insulin-producing cells in the pancreas and kills them all. Now, it is related to dairy because studies have shown that around the world, those countries that consume the most dairy and the most meat have the highest incidence of type 1 diabetes. Why is that? It's because certain dairy proteins, most problematically is one called BSA, bovine serum albumin, and also proteins that are in meat can stimulate an immune response by our immune system that will make antibodies that in susceptible individuals cross-react with the beta insulin-producing cells in the pancreas and kills them all. Well, so again, that's yet another reason to avoid exposure to dairy products and also animal protein. But let's say the horse is already out of the gate, someone has type 1 diabetes, do they benefit from a plant-based diet? And again, the answer is absolutely yes, because the damage that is done from diabetes to the body, the organs in the bodies, the vessels in the bodies, is caused by elevated blood sugar. Sugar is like gasoline. And like any fuel, you want enough to power your engine, but you don't want so much laying around that it's going to catch fire and burn up your car or burn up your house. And the same thing is true in the body. We want our blood sugar to be kept in a range that the fuel is available for the brain and for the muscles. But when the blood sugar levels start to get out of the normal range and too high, that sugar actually starts to cross-react with the fatty membranes that cover our cells, and it forms a type of plaque or caramel. I don't know if we have any cooks in the audience, but when I was growing up, my favorite cake was pineapple upside down cake. And the first step to making pineapple upside down cake is you melt some butter, some fat, you pour in sugar, and you sit there and stir it over heat until it caramelizes and forms this caramel. Well, a similar process happens in the body. Every cell in your body is wrapped by a membrane that is made up of fatty molecules. When the blood sugar level starts to get too high, our bodies are about 100 degrees Fahrenheit, you start to get this caramelization process occurring on these cells. When it happens in the blood vessels, it clogs them up, can lead to blindness if it's in the eyes, renal failure if it's in the kidneys, heart disease if it's in the heart, or limp Willie syndrome if it's in that special place in the guys. It can, if it happens on the nerves, you get neuropathy, that painful misfiring of the nerves because they don't function properly. So it's critically important to keep that blood sugar within the normal range. And if you have type 1 diabetes, if you're on a plant-based diet, your blood sugars will be much more controllable. They will be much more likely to stay within the normal range. And studies have shown that it limits long-term damage and allows these people to live much fuller, much longer lives without ending up with amputations, with blindness, with renal failure, and so forth.
So for Dr. Palmer, I'm going to skip around a little bit because I don't know if we'll get to everything, but one of the questions that came through was, should children be taking supplements on a plant-based diet?
Okay. So that question is kind of a loaded question, because a lot of times when people call themselves, because the new word is we're vegan or we're vegetarian. And so when parents come in and they say their children, because a good thing is happening is that vegan and vegetarian is popular, it's in right now. So a lot of the kids, a lot of the teenagers, they want to be vegan. They may be the only one in the house, which kind of creates a little bit of a problem. The parents are trying their best to help them out, but what ends up happening is that they're really becoming starchitarians or sugartarians. And so when you are calling yourself a vegan or vegetarian and you're really eating a bunch of carbs all day, then you're going to run into mineral, vitamin deficiencies, badly so. You're going to be more tired. You're gonna, a lot of times they'll come in and they'll be pale, so anemia becomes an issue. And so if you are truly being a vegetarian or a vegan, I should say, because we're talking about plant-based, that's why I don't like to use those terms, but plant-based, and you're eating plants, then you probably don't need supplement. But if you are finding that you're eating a lot of pastas, a lot of rice, a lot of things that aren't really nutrient dense and packed with the zinc, the selenium, the magnesium, and these things that the body needs, you probably will need some type of supplement to help out, especially if you are now trying to do veganism or a plant-based diet and you don't have you don't have anybody around to guide you as to what is good to eat and what I should not be eating. So some of the more popular supplements, like we talked about earlier, B12 may be necessary. Nowadays, vitamin D, which is actually a hormone, which we've learned about before. And that is not because of what we're not eating, that's because we're not going outside enough anymore. So vitamin D, calcium, not because we're not drinking milk, but because, again, we're not eating enough of the green leafy. You can get all the calcium that you need from green leafy vegetables. Greens and beans will give you your calcium. Our zinc, which is major for our immune system. And so there are some key ones that you may want to add in, but if you are eating a green leafy salad at least once a day, you should be covered, because our body doesn't require, often tell my patients too, and the parents, if you fill up your car on Monday, you don't need to go back to the gas station on Tuesday and get another fill. So if you are filling your system and bathing your body in green leafy vegetables, you will be covered as far as all the vitamins and minerals and things that the body needs down the road. You don't have to think. That's what I try to also take the mystery out of eating. You don't have to think about because we don't even know everything that our body needs. We know what's in the vitamin store, but there are vitamins and minerals in our body that we haven't even discovered yet. We have no idea what they do and how they function. The plants know. And so the best thing to do is to stick with the plant and let them figure it out, because we can't figure all of this out in our mind. So even when we are taking supplements and vitamins, we're not covering everything. So you can't, and I often use the analogy too, if I tell my patients, I want you to only shop at a vitamin shop for a year, or you can only shop at the grocery store in the produce section for a year. At the end of this year, who's going to still be alive? You know, you can't go to the vitamin shop and get vitamin A, B, C, D, plus, you know, they're compartmentalized and pulled out. It doesn't work well. So you have to think more whole, and we have to start compartmentalizing everything. Sometimes to kind of help parents to feel as if they are not, because I think a lot of people feel like if they are making their children or offering plant-based and their child is missing out on a lot. And I think people have failed to realize that just because your child is eating meat, that they are overweight or that they're obese does not mean that they're healthy. Because right now, 1 in 3 children in the United States are either obese or overweight. And so they are technically starving too. Just because you have a lot of calories in does not mean that your child is healthy. So as far as supplements go, probably the plant-based children and the standard American diet children need supplements, because neither one of them, I mean, the plant-based child, if they're truly plant-based, are getting it. But the standard American diet child probably is not getting a whole lot of the minerals and vitamins that they need either, because they're eating a lot of pizzas and ice cream and things like that, which lack a lot of the essential nutrients.
Okay, that makes perfect sense.
Can I just toss in a real quick comment?
Absolutely.
And this is a plug for the program I did with Baxter. But as Dr. Palmer just pointed out, our bodies depend on a whole slew of nutrients, phytochemicals, minerals that we get from whole plant foods. And if you're not eating those plant foods, all of us, not just the children, but the adults too, are deficient in a number of things, that some of which we know, some of which you don't know. And the problem is that you can get your blood sugar, your blood levels measured, and they'll tell you, oh, your white blood cell count is 5.4, and that's in the normal range. The problem is, because you haven't been eating the proper plant foods, you've got white cells that don't work. They don't have the zinc, they don't have the selenium, they don't have the other phytochemicals that they need to actually be able to kill bacteria, fungi, and viruses. So it's like having an army that has rifles, but the firing pins are missing. They're not gonna, they might look good, they might look pretty, but if you get invaded, they're not gonna be able to do anything for you. And that is part of the problem we're seeing with COVID, that people are eating all of this garbage food that has a lot of calories, a lot of energy, but it doesn't have the nutrients to keep their immune system up to date and replete. And so the minute they get challenged by something like coronavirus or the flu or something else, they get sick as a dog, and sadly, many of them will die because their immune system can't do what it's supposed to do because they haven't been eating the right foods.
All right.
And the body recognizes, I think I've been muted, but the body recognizes foods, not just isolated nutrients. And so, as Dr. Palmer points out, you get these nutrients in the greens and the whole foods, but it's not just the minerals by themselves, but right. You have to understand these minerals in nature, they exist in a milieu. There's a certain stoichiometry of the molecule. There's a milieu, there's the pH, other molecules that are interacting with these molecules. And that's really where the nutritional component is. If I give you something that's isolated, it's not the same as the whole food. And so, you know, Colin Campbell likes to use the analogy of a symphony. You know, you hear the music all together, but if you just cut everybody else except the trombone players or the flute players, I mean, yeah, it sounds okay, but it's not the same. And so the food is sort of a symphony of nutrients that are interacting in a very special, unique way that we don't understand. So not only do we understand all that's there, the stuff that we know that's there, we don't understand how it exists and how it interacts with the other things that we know that's there. And so it's a much more complex process than we understand. So that's why you really have to go with the food, the whole food, and not just isolated nutrients.
Right.
Great analogy.
It was. And so I'm going to stay with you, Dr. Montgomery, because we're going to do the closing question for each one of you. And for you, the question is, and what this came from is there's folks out there who will say, oh, you can't just, do this cold turkey, or you can't just jump right into eating plant-based if you're, say, like on medication or this kind of thing, like it's so quote unquote dangerous. So I was going to ask you, are there any concerns someone on heart medications should have in transitioning straight to plant-based eating?
Yeah, so what we do routinely in our clinic is that we have a process when we see patients, and we frequently see patients on 15, 20, 30 medications. And part of the process is to put them on a nutritional cleansing regimen, a detox diet, and we follow them very closely. And we monitor their blood, their hemodynamics, and all of those things. And we also reduce medications, and we do that intentionally. So it's not a matter that you don't need medications to be healthy. In some people's situations, you need to come off medication to be healthy because excess medication have adverse effects. Now, let me be clear. People on the medications, yes, you need to be under doctor supervision, et cetera. If you're on, say, a medication we call a beta blocker, and these medication has a reaction with certain receptors in the body. If you're on medication for a certain long time, it causes the body to adapt to the presence of that medication. So the presence of that medication causes your body to adapt in a certain way to where when you remove that medication, that adaptive process can be problematic, meaning that if you're on a blood pressure pill for a long time, if you suddenly remove it, you can get a rebound elevation in blood pressure that can be potentially harmful. It's almost like if you're pushing up against somebody and they're pushing up against you, and both of you pushing back and forth, and they suddenly release, and if they release too fast, you fall on your face. And so it's that type of phenomenon. So what we do is when we introduce a nutritional regimen, so a detox diet, it will then do things to lower the blood pressure. So if it does things to lower the blood pressure, then I no longer need the blood pressure medication, so then we can wean the blood pressure medication. And similarly for other things. Insulin is another great example. We have patients on insulin, and we put them on a detox regimen. I frequently will stop the insulin within the first day or two or before they start the detox, because I know if the blood sugars are normal and they start the detox diet, they're at risk for having blood sugars that are too low, which can be dangerous. So the point is simply this. The answer is yes, you can come off medication. 2, yes, you should come off as many medications as you can. Yes, some people have to stay on certain medication. If you have a history of transplant, you're on anti-rejection medicine, you have to stay on that. People have a thyroid that's missing, sometimes they have to stay on the thyroid medication. But you have to have minimized medication. We've had people come from 23, 24 medication, get them out of 1 or 2 or none in a relatively short period of time. The minimization, or to some extent, absence of medication is going to improve your health, because if you're relying on your natural lifestyle, fresh air, sunshine, water, plant-based diet, to maintain your body's biochemical homeostasis, body's physiological homeostasis, that's the most natural way of doing it. Not only that, that allows all the organs to work. If I'm having to rely on antihypertensive drugs or anti-cholesterol drug to keep your blood pressure controlled, keep your cholesterol controlled, those numbers will be okay, but these medications are harming other organs in the body. They're harming other problems in the body. They're causing other problems in the body. So even though you may fix one problem, you're causing maybe 20 other problems with the side effects of that medication. And the problem with the side effects of medication, and these medications can have underlying side effects that you don't discover for years. I'll share this slide with you briefly and just share a personal story, and then we'll let you go. But the point is this, we published a study where we looked at a defined plant-based diet, we reduce cholesterol and blood pressure and reduce medication by 40%. And so you can have the best of both worlds if you follow the proper nutritional regimen and then you do the right things. This whole issue of medications is very close to me because, my mother, years ago, my mother died in 2002. And so she was diagnosed with a brain tumor, meningioma, really. And so we worked her up, and so it was an easy tumor to resect. She had a cardiac workup because she was a diabetic. She was on 5 different medications for diabetes and for cholesterol and so on. She followed the diet, complied with the medication. She saw a gastroenterologist and some GI issues. Never had abnormal liver enzymes throughout her whole career there, and he would follow them, etc. Of course, I didn't know about plant-based diet at the time. So her hospital course went when, after she had the tumor resected, when we cleared her, she had the meningioma resected, they had to put on anticonvulsant medication prophylactically. When she got on these drugs, she would go comatose. The Latin, she didn't tolerate any of these, and they didn't understand why. So she had a lot of complications of hospitalization, waxing away, mental disorders, etc. And she eventually died. And I was taking care of her in part with other physicians. She died of liver cirrhosis. Now, her gastroenterologist never saw an abnormal liver enzyme throughout her years of taking care of her, and he was baffled. She had abdominal compartment syndrome. I had to do an emergency pericarditis one night because she had fluid around her heart with tamponade. But eventually she died of liver failure due to cirrhosis, and it was because of the anticonvulsant medicine. When I reviewed her record, not only was she on the standard American diet, as I pointed out before, which has abnormal liver function effects on the liver, but she was on 5 medications that were cleared by the liver, and we added 2 more during the hospitalization, which further destroyed the liver. So she didn't die of a meningioma. She didn't die of heart disease, which she did have. She died of what's considered the 3rd leading cause of death, side effects of medicine. But the medication was killing her for decades over time. So I'm very sensitive to medication, effect of medications that happen. In fact, on her deathbed, she taught me one of the most important lessons of my life. In fact, how these medications can kill you and how the lack of a natural lifestyle can shorten your time here and also decrease your quality of life. So medications, yes, they have a role, but that role should be limited, very targeted, and only absolutely if absolutely necessary. And what I do with my patients, I'm constantly trying to get them off medications. I'm constantly trying to detox and wean medication because it's not a very trivial matter. And we take these things very trivially.
Thank you so much for that. So Dr. Mills, similar question. Do you have any advice for someone who is experiencing multiple health issues, for instance, diabetes, hypertension, and heart disease, who is considering transitioning over to a plant-based diet?
Yes. I want to say that my advice to my patients is cut it out. Cut the animal products out. Go, as they say, cold turkey. If you got to lay on the floor and kick and scream and sweat for a couple of days, do that. But to me, when people try to wean themselves off animal products, it's like somebody saying, okay, I'm addicted to crack, so I'm gonna stop smoking crack on Monday, Wednesdays, and Fridays, but the other days I'm cool. That does not work. It's like an alcoholic saying, okay, I'm gonna stop drinking, but on Fridays I'm gonna go out with the people from the office and have a couple. No, what's gonna end up happening is you're gonna end up back in the crack house. You're gonna end up back in the gutter from being a drunk. So I advise people to cut it out and let your body, as Dr. Montgomery says, detox off of this unhealthy food. And before you know it, you're going to start feeling so much better that you won't want those things that you used to have. And I got a couple stories because this happened to me last night. Actually, it was early this morning, probably about 2:30 in the morning. I got called to go to one of the units in our hospital to actually, sadly, pronounce a patient. But one of the nurses there said, Dr. Mills, I just want to let you know, I saw you in that movie, What the Health. And I went out to visit a friend of mine, and she was plant-based, so she got me started being plant-based. Now I'm off all animal foods. She said, I've had hyperthyroidism for years. I was on this medicine called methimazole. I didn't like it. I went off it. My heart rate would be in the 130s. She said, since I've been plant-based, my heart rate is in the 80s, which is in the normal range. And I'm off all these medicines. I mean, this is for real, for real. And so, and especially if someone has things that are affecting multiple organ systems, it is so beneficial to just cut out all of those animal products to let your body start to heal. Another story. Last year I went to New Rochelle to do a program, and this woman came up to me as soon as I walked in the building, hugged me, and she said, I just want to let you know, I think the world of you. And it turns out she was a Facebook friend of mine who I'd never met, but she told me her story. She had lupus that was so severe, she was on the highest dose of Plaquenil allowed by law, and her doctor was ready to start her on, and Plaquenil is very toxic, to start her on another drug, methotrexate, which is a chemotherapy drug. Allison told me that she was having problems with congestive heart failure, her kidneys were starting to shut down, and she was having liver problems. She saw What the Health, decided she was going to give plant-based eating a try, told her doctor, he said, if you do that, you're going to die. Allison said, well, I'm going to try it. She went plant-based. She is off all of her lupus medicines, and all of her lupus markers have gone down to 0. So this is, I mean, these are not flukes. These are not one-offs. This is what happens when you stop these toxic foods and allow your body to heal. Now, caveat, I would always tell my diabetic patients, you cannot repair fire damage to a house if the house is still on fire. So my point is, if you have diabetes and you want to transition to being plant-based, I tell them you're going to have to start taking your blood sugar 5 times a day, because we're going to start weaning you off your medicines very rapidly, but I want to wean you off. I don't want you to just stop, because I don't want your blood sugar, shooting up sky high. So it's like what Dr. Montgomery was saying with the beta blockers and other medications, that you wean the patients off, over a relatively short period of time, but in a lot of cases, you don't just suddenly stop the medicines, because that can make a situation worse. But the bottom line is, I'm a firm believer that you eliminate all of the toxic substances, and there's so much in plant and animal foods that are literally poisonous to our system, that to really allow your body to start to heal, you have to stop them all. And then wean off the medicines as your body begins to heal and remake itself. And before you know it, you're going to be a new person with a new body, because our bodies remake themselves completely about every 3 to 6 months. Most people don't think about that, but you have to, our tissues wear out just like any other machine. And so the body has to constantly replace them. Well, when you start eating better, your body actually starts using different genes that actually make new, stronger, more efficient proteins, so that you end up with a brand new body. And that's why you feel so much better, and that's why you're so much healthier. And let me I want to just touch on question number 6. Should men with, family history of prostate cancer be eating a plant-based diet? And the answer is yes, yes, yes. My mother had one brother. His name was Milton. She named me after him. My uncle died from metastatic prostate cancer in his 50s. Prostate cancer is 60% higher amongst African Americans than it is Caucasian American males. And once we get prostate cancer, we are much more likely, we're more than twice as likely to die from it, because we don't get these indolent forms of prostate cancer that allow you to live for 10 or 12 years with the disease. We get aggressive, deadly forms of the disease that metastasize to our bones, skeletons, and destroy our body. Number 1 risk factor for prostate cancer, consumption of dairy products. Notice I didn't say dairy foods, because they ain't foods, they're products. And it's because of the hormones. dairy products are loaded with estrogens and glucocorticoids. And it's also because of those very potent growth proteins that are in the dairy that stimulate the growth of cancer cells. So without question, if you have prostate cancer or you are at risk for it, in other words, if you're Black, yes, you need to become plant-based.
And then the final question for Dr. Palmer, and this came up because we have a lot of people who find out about us, once they already have children who are already eating the standard American diet, and they have questions about transitioning their children, from toddler all the way up to adolescent. And so I was just wondering, do you feel like there are any health concerns that someone should have when considering transitioning a child to a plant-based diet?
I think they're not health concerns, they're health benefits. Because, the reality is our standard American diet is starving our human bodies all the way around. Children are in growth and development stages. And with what we're eating, the standard breakfast is cereal, which lacks a lot. The standard lunch is kind of a sandwich of some sort, usually with some meat on it. Dinner is pasta. So there are no greens, there's nothing there to really give the body the fuel and the minerals, vitamins, enzymes that it needs. So basically it's amazing that children have the energy and the go that they do, because a lot of them are in a chronic stage of deficiency. And I do believe that this is also attributes to what we see now. We're calling it ADHD, but a lot of children have difficulty with being able to keep their mind in one line of thought. They may not be able to recall a question that their parent has asked them, or a series of tasks that they've been asked to do. They may remember the first two and forget the third one, because this is the time period when the nervous system is, it's being laid out. And we're learning things, synapses are connecting. And if you're not providing your body with the right nutrients and minerals with our standard American diet, then those connections aren't happening. And so we get a lot of holes in the development and growth of our children. So the health concerns have more so to do with the lack of getting certain things. And that, again, is true in the standard American diet. It's just more of a mindset that we think that if we switch over to plant-based food, that now we're not going to get these minerals, because actually you're getting a concentrated, you're getting these minerals more concentrated. Now, it is a little bit of a challenge to get parents to really think plant-based, because a lot of times, like I said before, they get into doing a lot of starches, which is going to lead to deficiencies. A lot of times too, the cold turkey, parents are very skeptical of that with their children, because they don't see their children as being sick. When they're constantly coming in with colds and congestion, and flu season is horrible every year for us in pediatrics, they don't see that as this is an underlying problem in the house. They see that, oh, this is the new normal. So this is normal. It's normal for me to have to go to the doctor every month with my child because we have another ear infection. Or it's normal that the asthma every spring and every fall, the asthma flares. So these things have been normalized. And so trying to also teach that sickness is not normal. We should be able to make it through the year with no sickness. That used to be a concept years ago. Now that concept is kind of out the door, where, oh, I just had 4 colds this year, or, this is my allergies. I hear this all the time. This is allergies. And so we have normalized sickness. So trying to convince parents, we need to get back to a state where our children, and we are not okay with being sick and having to go to the doctor to get medicines every couple of months because there's a problem in the household. So I think it's more of a mindset. I don't think there's any health concern with switching over to a plant-based diet because you're getting more of what you need in the concentrated form. I think it's a mindset. And then also it's you have to be mindful that people are now going to be all of a sudden telling you how to raise your children, right? So
That's certain.
so, you know, now people are asking you, well, why can't they have the ice cream? Why can't they have the cake? It's its birthday. And so now people, and even family members, will challenge you on what you're feeding your child and why you're not feeding your child this and why this isn't fair to your child. So now all of a sudden your child is their child and they care about what goes into your child. So you have to be ready for that, because that does play into a parent's psyche, and it makes you feel like you're not doing the right thing for your child. But again, you have to get the information and be strong in your conviction that I'm doing the right thing for my child. This will be beneficial, because at the same time that you are teaching this, even if the child gets upset with you, you are laying the foundation for the rest of this child's life. Okay, and so that's what I try to remind parents. Nowadays, there is a trend where everybody gets dessert every night, which is crazy to me, but people get dessert every night. And so I try to remind parents that is not good, because you're teaching them that they need to have dessert in order to sugar to end a meal. And that is not a good thing. And so, you know, we have to be careful about the messages that we're sending our children in these very impressionable times that they're in right now. And so being mindful of what we're doing and the message that we're sending, being mindful about the people around us, being prepared. So when you go out, now that we're also a snacking society, so we snack, everything is snacks, keeping some grapes with you, keeping some carrots with you, keeping some celery with you. If we need to do our snack thing, we have our snacks with us. We don't need to stop at the convenience store. We don't need to stop somewhere to pick up something, because most of the time when we're stopping somewhere, we're picking up processed food, which ultimately is going to make us more hungry, because it is not a complete food. And so it's not going to satisfy any type of hunger. So, you know, I think just getting parents in the mindset of this is going to be a journey for you and your children. And hopefully as we're changing this mindset for your children, the whole family has to change. That's the thing about pediatrics. I can't just change one child. Everybody in the family has to be on board with this plan in order for it to work, because a child is looking at the parent. And if the parent is not doing it, they're not doing it either. You can talk all you want, but they're not going to do it unless they see you doing it. And a lot of times parents will be on board with changing things for their children, and then they see the benefits for themselves and they'll stay in line. But just know that you're doing the right thing for your child. There are those of us who I spend a lot of time trying to motivate my parents that it's okay if you do fall off and you have a cake, because children will be children. They're going to go to a birthday party. They're going to sneak a cake. You know, don't let that discourage you. Just come back in line, because as we said before, the human body is very forgiving. It will reset, it will restart. A lot of times, if you have been plant-based and you do eat a piece of cake, you're gonna get diarrhea so fast, your body's gonna reject it. It's gonna reject that cake. I'm using cake as just an example, but it's gonna reject that whatever it didn't like so quickly. You're gonna be like, wow. So once you get your body to a point where it is functioning and using the proper minerals and vitamins and foods to do what it needs to keep us healthy, it's going to do the best it can to keep us healthy. And it's going to get rid of anything that is seen as an insult or as a problem to it. So in summary, health concerns on the plant-based diet for children, no. I think parents should just be ready for the outside world is going to have a lot of opinions all of a sudden on what you're doing, but just know that what you're doing is the best for your child. And we all want to do the best for our families, the best for our children, to give them a bright, the best potential for the future without going into life feeling like when I get to the certain age, I'm going to have this chronic issue because my uncle, my brother, my sister has this issue. So giving them the best foundation is paramount.
Thank you. Thank you. Thank you so much. And thank you to all three of you. I can't even express how much of a gift that this panel has been. I mean, it's been a dream. Honestly, I can't believe that we were able to get all three of you, to the same place at the same time. And it was painless, which is not always the case with our panels. So I'm so thankful to all of you. I want to stay connected with all of you, each and every one of you. And thank you so much for giving of yourselves and your expertise and your knowledge and your humor and everything that you brought to this panel discussion today. Thank you for participating in the National Afro-Vegan Virtual Conference. This is the first one. And hopefully at some point it won't be virtual because we'll be allowed to go back out into the world. And let's please stay connected. I know that our watchers, our followers are going to have questions for you. So we're going to make sure to include within this broadcast the way that folks can reach out to you personally. Did you want to give, if you have a website or like an email or some kind of way that folks can reach out to you, even if it's like social media or whatever, would you be interested in giving that?
Well, let me say that this was a wonderful event. I actually learned a lot. And so I really want you to be sure and get me the link for the edited version when you guys get it done, because I want to put it up on my website. And that website is Dr. Milton Mills plantbasednation.com. So that's all together. It's just Dr. Milton Mills plantbasednation.com. And there's a lot of good information there. And of course, I'll stay connected with my colleagues as well.
All right.
Yes, and I'd like to reiterate what Dr. Mills says. I really enjoyed this and I learned a lot, as I usually learn on these types of conferences, but especially this one. I could be found, my website is montgomeryhart.com, montgomeryhart.com. The questions can be sent to wellness@montgomeryhart.com. Our nutritionists will field those and they can get those to me, but wellness@montgomeryhart.com. And then look us up on YouTube. We have a show. Both of these talented doctors have a routine on this show. So you can get more information like this on our YouTube show. It's Montgomery Heart and Wellness on YouTube. Just Google that. But anyway, it's been a pleasure. And I too would like to get an edited version because I think this needs to be shown to a lot of people.
Absolutely.
And we need to do this again. I don't know, maybe, I don't know, you can, I know you have the Afro-Vegan community, but maybe like you say, going on the show, we can do this with churches or whomever. Or just re-show this broadcast to other entities, I think would be very, very important.
Absolutely. Dr. Palmer?
Yes, and Brenda, I would like to thank you. I'm honored to be here with Dr. Mills and Dr. Montgomery. I've watched them over the years, and so to be in a box below them is an honor. So thank you for reaching out to me. But so I'm in my infantile state of growing a site, but my website is www.beginninggreens.com. And my email address is info@beginninggreens.com.
Thank you for tuning in. Click to watch more sessions.